Want to learn what's new with dental products and services? Come join us. Welcome, everybody, to the Digital Trade Show Dental Podcast, where I am sitting down with the amazing people in the industry and having them talk about their companies, their products, their why, their outlook on the future, all kinds of exciting things, and maybe even some things about them that you didn't know. I'm your host, John Stamper, and thanks for joining me. This episode of the Digital Trade Show Dental Podcast is brought to you by TSYS, one of the nation's leading providers of payment processing services. Whether you need a secure payment gateway, an easier way to set up payment plans for those patients that want to get the dentistry done but don't always have the funds up front, or a time-saving system to automatically post your credit card payments to your practice management software system at the end of the day, they have it. So it's one thing for me to come on here and list all the things that they do. It's a whole other thing to meet them in person and see it in action. So that's what I did. Got in the car, drove down to Charlotte, North Carolina. I got to spend a couple of days with their leadership team, all of their members that are speaking with dental practices all over the country. I got to listen in on some of the phone calls on some of the things that the dental practices need and really watch how they handle that whole situation. I was really impressed by their vision, but most importantly, how they have taken payment processing and humanized it. So I really encourage you to go check them out and learn more about some of the innovative solutions they are providing in this space. And right now, I'm really excited that for all of my listeners, they're making available a $300 activation credit to anybody that signs up for their service. Now, this is the equivalent to the cost of the machine for an entire year. One of the things that I also was impressed with is that how many times have you been using a practice management software system and you were using your merchant processing with that, and then you had to switch and you had to use the merchant processing system that came with that practice management software. Doesn't work like that with TSYS, and I think that's what's awesome is they're very, very flexible, and they've built their systems to be able to plug and play with whatever it is that you have in your practice. Another great thing, no contracts. So if you want to take advantage of this awesome activation credit that they're making available, just call 844-545-6255. That's 844-545-6255. They've got a great team there answering questions from dental practices all over the country. Go ahead and let them know that you heard about them on John Stamper's Digital Trade Show Dental Podcast, and they will be sure to answer any questions you have specifically about your payment processing and any and all the needs that you have around that very important part of your business. Be sure to mention the activation credit. And once again, the phone number is 844-545-6255. What's going on, everybody? Happy 2019 and welcome to the Digital Trade Show Dental Podcast. I am very excited as I look out towards the first part of this year to bring to you this podcast series in conjunction with Dental Consultant Connection. So towards the end of last year, I got the wonderful opportunity. I was introduced to Robin Morrison, who started Dental Consultant Connection, and we got talking and was learning more about her company and what she does. And it was very fascinating to me that there would be an organization that had pulled together coaches and consultants, all with their own unique expertise and focus, and then have them there and available based on the needs of a dental practice. I love the idea. As so many of you know, the decision to bring somebody into your practice, regardless of what they do, can be a very overwhelming decision. There's a lot of things to think about, and not one person knows anything and everything. And so certainly having the ability to be able to have focused experts in specific needs of your practice really is a cool idea. And so I thought that it would be helpful to bring on each one of the team members from DCC on a weekly basis. And so Robin and I talked about this, and we thought we'd put together a podcast series to get the year started. And the theme is practice strategies for the startup and the season. So what we're going to do is each week we're going to have one of her team members come on. We're going to start with having them come on the DentalCast Productions Facebook page on the I've Got 10 video podcast and have them just share 10 minutes worth of a a couple of tips for the startup practice and or the seasoned practice. And then we'll have them come here on the Digital Trade Show Dental Audio Podcast and have them share a little bit more about themselves, their story. As many of you know, that is something I'm very, very passionate about. I love people's stories. I think it is the one thing sometimes that is the difference between any consumer making a decision on what they choose to purchase, is knowing a little bit more about that person. And certainly if we can do that and we can showcase so many of the great personalities and people in dentistry and have them come on and share their story, it makes it a little bit easier when it comes to making that decision on the product or service that you want to purchase. So I am very excited, as we said, to get this thing started. Robin was very gracious to have one of her team members come on once a week, and we're looking forward to where this goes, but more importantly, providing great content for you, the dental professional, that you can take a couple tips here, a couple tips there, apply in your practice, but more importantly, if you want to take advantage of some of these great resources that Robin has available and the people that she's working with at DCC, would love to have you reach out to dentalconsultantconnection.com. Learn more about them, learn more about the great consultants, and I will certainly do my best here on a weekly basis to showcase their talents, learn more about their stories, and most importantly, always try to provide great content for you as you listen in your busy schedule. So, without a further ado, here is this week's episode, Practice Strategies for the Startup and the Seasoned. All right, everybody, we're going to get started here with my guest today on this special podcast series on the Digital Trade Show Dental Podcast. As I've shared with many of you, was very excited towards the end of last year to spend some time with Robin Morrison, who is the founder of Dental Consultant Connection. She has created an amazing group of consultants, and I think what's unique about what she has done is they all have their unique specialty. So it's pretty cool when a dental practice calls and says, I need someone that can help me with this or whatever the case may be. So really excited to keep this podcast series going. And today, true honor, when you think about medical billing and dental billing and all the changes in insurance, just those things that make us go crazy, sure would be nice to have a resource. Well, today we do. And so I'm very happy to bring to the podcast Christine Taxin, who is a part of DCC. She also has her company. She's the founder of Links to Success. Has been doing some events lately, and she's out there speaking all over the place. So, Christine, welcome to the podcast.
Thank you, John. I love being with you.
Well, it's very kind of you. So, before we get started, we'd love to have you share. It's always interesting to me. People are out there on a daily basis doing what they're doing in the dental field, but I love people's stories, so we'd love to have you share just a little bit about how you got to where you are today.
Well, it's been a long road, honestly. And, I've been in dental and medical my entire working career. So I had experience in billing both. But our daughter got sick, and we realized that a lot of her oral issues were a combination of what medications they were giving her and the type of illness that she had. And I just decided I was going to start talking to people. And I started talking to companies that made products to remineralize tooth structure and things like that. And then I started speaking to dentists across the country on what they see when patients take this medication. And a lot of them said the same thing: dry mouth. Dry mouth, not because they're doing anything incorrectly, but dry mouth from medication use. And that just started me to say, I'm going to give it a shot. And it wasn't for me, but there were a lot of young teenage kids in the facilities with my daughter, and these parents were struggling financially to make things happen for their kids. And I decided, well, you have a skill. Let's see if we can help these kids get the dental work they need. And it worked. I started billing medical for all those kids with the dentist that was by this facility's permission, of course. And it just was like, we were helping so many kids get the treatment they needed because we were now billing medical. And it was an eye-opener for me. And then it just started to spiral. And I decided, well, I'm going to go study this more and joined organizations within the dental world, within the medical world. And it just bloomed into more and more. So what today is bringing is that everybody is aware of the systemic connections, but nobody is aware of how to make it connect. And that's where I come in. Because we know about these things, we hear about these things, and now I even have patients emailing me, can you help me? Can you help me find a dentist? So one of the things that I decided to do is that I like to share whatever I can. And the doctors that have taken courses from me who know how to bill medical are now going to be on a map. And when patients do contact me, I can tell them to go to the map, and there'll be doctors within their state that have taken my course and understand how to bill medical. And all these doctors know that if it's a case they need help with, and they've worked with me before, I'm going to help them because these patients deserve to get the treatment they need. And it's not about just money here. It's about the patient able to access and get the care that they should get. It's just like, why is your oral cavity not connected to the rest of your body? What does that mean? And so if we're going to preach that, then we need to be able to help them. So that's where I'm at.
Well, it's a pretty damn good story, and it's it's always fascinating to me, and it's the reason why I love to ask people is because I think there's so much more as to why people just get up one day and start doing what they're doing, right? And as you just shared, there typically is a personal story. Often I talk to entrepreneurs that created a product in the dental practice, and it all came from them being frustrated in the operatory or whatever the case may be, and those are the best, right? Because I think that energy or the situation that you had to deal with probably drove you guys, as I'm sure it did, to really be passionate, spend a lot of extra time on this. And now here we are, and you've become such a great resource. So thank you for sharing that.
You're welcome.
So let's get into, we just talked about this on our video podcast over on DentalCast Productions Facebook page. Let's get into really why is medical billing and dental billing starting to collide and why is becoming so mainstream. Let's start there. And then we're going to share with everybody 3 examples of some specific things that you want to share in regards to how they could use, some of this billing education.
Okay. Well, the biggest thing that happened in the last 2 years or 3 years, Medicare asked the dental world to become a Medicare provider. Now, what they don't understand is that they didn't say you have to be an in-network provider at all. But because Medicare changed a lot of the way the law reads, and the law now reads that, if a patient has insurance and DDS or DMD is providing those services and it is a medical necessity, that an insurance company can't deny it unless it's a clause within the policy, but not legally except if it's written in the policy. So it gave us an opening. But what happened is a lot of dentists didn't understand it, so they opted out. And by opting out, you limited yourself to just being able to write a prescription and just being able to refer a patient to a specialist for a biopsy or a CBCT scan and not have anything to do with billing on their own. But today, John, I'm a baby boomer, and baby boomers have very loud voices, okay? Because we were asked 5 years ago, there was a survey sent out to everybody in the baby boomer age group, not everybody, but a large portion, and asked, what are the things that you want in your Medicare coverage? And we all obviously wrote the 3 things we think of, which is your eyes, your vision, your oral cavity, and your hearing. And guess what? None of those were covered under Medicare. So what happened is Medicare Advantage. Companies decided, wow, we could help these people get that coverage. So Medicare can't afford to do it. So what they did was they have a contract with Medicare. Medicare gives them whatever amount of money we would be getting as a Medicare patient. And we have the option to add those other benefits on at a lower cost than an insurance policy typically would be. So, we are getting coverage today for things that are typically not listed under Medicare. So we're in a whole different category. And doctors don't understand that category is viable for them to be treating these patients. I don't want to go to just anybody. I want to go to doctors that I feel I can trust, not because they're in network only. So Medicare also has 3 options. You can be in-network provider, you could be a non-participating provider, or you don't have to provide any of those things, and the patient could pay up front, but you could still bill for them to get reimbursed. So what a concept that is. And I think that is something that's changing our insurance industry. And they call it embedded medical. That's what it's called. So what happened? Other companies decided, well, if people don't have dental insurance, they can get an embedded policy. So there are going to be more and more people that are going to have medical benefits for dental treatment when it's a medical necessity, not just for cleaning, not just for certain things, but because of the systemic issues, they become a medical necessity. A pregnant woman who has onset diabetes is a medical necessity. We need to help them. So that's really where we're at. And I can't even express enough how much changes there are. So that's why I want to just give you examples, John, so the audience can hear something that they can touch and feel and see on a daily basis. So you could have a patient come in and needs a surgical extraction, and now you know that the opioid drugs are, they really be a watch on what doctors are writing across the country. Most are electronic prescriptions at this point, and they are watching it. I mean, it's all over the news. We are watching opioid prescriptions. So versus writing an opioid prescription, they now have the ability to use a product that's been in medical for the last 5-6 years called Exparel. And it is an opioid that's placed in the pocket so that there is no pain, but it's not going to travel through their blood system. And they're not going to get addicted. And it lasts anywhere between 48 and 72 hours. So, I mean, that's just an amazing product. Right. But at this point, only 2 dental insurance companies that I know of are going to cover it. It's also expensive. So if you use it under the dental, if there is coverage, you're going to use up a lot of the money for a product that you would have never needed to use 6 years ago because we didn't have it, number one. And number 2, we just wrote a prescription. So billing it to medical is really going to help the doctors stretch their patients' insurance money. It's also going to be a benefit to their patients' health and well-being. And they're not writing as many prescriptions that are going to be tracked because it's an opioid.
Right.
So it's a win-win.
Absolutely.
Bone graft,
Yep.
right? But I mean, that's just a win-win. And then you have bone grafting where patients actually will call me or email me and say, I had bone grafting and it didn't get covered under my dental. And I asked for them to bill my medical, and they don't know how. And can you do it for me? Well, the problem is I want to help everybody, and it's not about helping them. It's about I legally can't code for a patient. Only the doctor who did the service knows what he did. So they may be able to tell me, but I still can't bill it because that doctor's MPI number must be on the claim form. And I don't have a relationship with that medical provider. So I can't bill for a patient, no matter what, unless I get permission from the doctor and we have to do a business associate agreement. It's a lot of paperwork even to do it for free. So it prevents me from helping these people that call me. And that's why I started this referral program, because my goal is to make sure that as many people as possible can get the benefits that they deserve to get coverage for. And I'm willing to teach the teams, but I can't be on the phone all day with different members. That's why I do hands-on across the country, because you're actually learning how to bill. It's not me talking. It's them bringing their own patients' cases and me helping them work through the entire policy. They learn how to look up a policy. They learn how to look up the codes. They learn how to document properly and all of the things that will help them help patients. Mm-hmm. And then they have the opportunity to just keep working with me on a monthly basis in the beginning. So I just have tried everything, and I believe that we have been very successful in doing that and helping as many people as possible. But John, the audience has to understand this. The doctor and the team has to have some dedication in making it work, because I can't guarantee everything. I can teach you everything. I can help you through an issue, but I can't guarantee anything. And a lot of people say, well, you didn't teach me right. Well, I cannot teach somebody how to do this if they're still working every day in between. You know, I need to bring that out, because I think that the doctors need to understand that if they had to learn how to do a surgical procedure, they would go and take a course and not be worrying about what's going on in their office. And that has to happen for team members. They need to be able to concentrate on this to make it a viable solution.
Yep.
I hope that.
I'm glad you shared that. Again, I think with so much of this stuff, there is no cookie cutter way. I also think it's important that you bring up setting the expectation from the beginning that we're going to go down this path that maybe was not viable before in regards to getting this covered. There are no guarantees, but I think like with what you've said, Christine, is if 1 turns into 3, turns into 7, turns into 20 over time, the good news is for many of those patients, that was not there before. So 3 is better than 0. And, but it's a commitment, and I'm glad that you bring that up. And I know, some of your events that I've been at, I mean, that's one of the things that you tell people right up front that I think is super important. And one of the things we were talking about in the video podcast is your connection with Robin at DCC. And talk a little bit about that and the auditing. And I think that was a very important point.
Right. And I just want to bring out a conversation on DCC and why it's so amazing and why it works is because we all can't know everything. And I'm the first one to say, I don't know everything. And when we are able to do that as consultants and speakers, we give such a big benefit to the client. And we all bring in each other. And that's the great part of working with DCC. I've done auditing for DCC, along with OSHA auditor Leslie Kanan. So it's a collaborative effect. And that's what we teach. I teach medical billing as a collaborative effect. You need everybody on board. But so do the consultants that work with DCC. We work collaboratively. And the best part of it is we can talk to each other. It's not a competition. It's not about us. It's about what's the best fit for this client. And that's the beauty of going through there, because there's somebody that can meet anybody's needs. It doesn't necessarily mean the same person. And for auditing, I get called in more for auditing because I know medical billing and dental billing. And I know documentation laws. And I know what the insurance companies look for to pick on. And so, that's why I'm called in. But would I ever get called in to do OSHA, where I got to look at the sterilizing area or any of that? Never in a million years. I would never take that job on. Or I would not take on training in some other areas of the practice because it's not what I specialize in. And there are some people that specialize in the phone and verbiage, and those are the people that should be in that office for those types of needs. And right. We all have a job, and we all have a specialty. And even going into a dental office, just because a person is not the right person to be the greeter, doesn't mean they're not the right person to do your social media.
Right.
So we need to look at people's strengths in every situation. I do that when I go into an office because I know that billing has got to be a strength and a character and a want. And if that person doesn't want it, they're not going to learn it, no matter what.
Yep, absolutely.
So that's what the beauty of DCC is.
Yeah.
It just teaches us to collaborate.
Yep. Well, and I think to that point, I mean, that's a great way to kind of segue and wrap here, is to let everybody know that you can learn more, not only about Christine and all the great things that she is helping practices with and professionals with over at dentalconsultantconnection.com. That's dentalconsultantconnection.com. But you will also then learn about all of the other individuals that are there doing some great things. So be sure to check that out. Christine is doing a lot of events, webinars, all kinds of cool things to educate the industry. So it is always a pleasure to have you on. Your passion is contagious. And thank you. I really, really appreciate you coming on the Digital Trade Show podcast. And I look forward to watching you continue to do some great stuff in dentistry and medical, I guess you could say, right?
John.
You're welcome. All right, Christine, have a great week.
Thanks, John. Bye. You too.
Bye-bye. What's going on, everybody? John here. Hope you enjoyed that episode here on the Digital Trade Show Dental Podcast. If you liked the content, liked the guest, and you are looking to add another podcast to your mix of podcasts, just seems like they're growing like crazy, right? Would love to have you visit iTunes and or Google Play and subscribe to the Digital Trade Show Dental Podcast. As I add episodes out there, those will come through on your listening device of choice, and would love to have you become a member. So moving forward, want to let everybody know that very excited to announce that I have taken all of my podcasts, Digital Trade Show Dental, Digital Classroom, the video podcast that I do on Facebook, consolidated everything into a brand new company called DentalCast Productions, doing a lot of the podcasts, also going to be doing live event recording, all kinds of fun things. And we've got a new website, dentalcastproductions.com. That's dentalcastproductions.com. Would love to have you visit the site. That's where you can listen to all the podcasts. We're also starting up a new newsletter. Going to have a lot of great information and content from my guests, and certainly we will only send you stuff if you choose, but I think you'll like it. I think there are a lot of great things that so many of the great companies in dentistry are doing, and would love to have them bend your ear and or your eyes in a newsletter for a small amount of time during the month to share the great things that they're doing. So go ahead and head out to dentalcastproductions.com. You can subscribe to the newsletter really easy, and we really appreciate it. And as always, if you enjoy the the podcast. We'd love to have you share it out to all of your other dental colleagues. It is greatly appreciated. And with that, have a wonderful day.